Hi and welcome everybody. My name is Clark Atterbury. I'm President and Financial Advisor with Atterbury Investment Management. The topic for today's interview is retire healthy as well as wealthy. All your Medicare questions answered. I'm very excited to introduce you to today's guest, but you may be wondering why I'm talking about Medicare when I'm a financial advisor. We have a holistic approach to our practice. We deal with people investing, investment management, retirement planning, and you can't talk about retirement planning without talking about Medicare. So it is my distinct privilege to introduce to you today Ms. Vickie Braden. Say hi, Vickie.
Howdy. How are you doing this afternoon? Clark, thank you
Do it.
so much for having me today.
Oh, you're welcome. I'm really excited you could join us. Thank you for accepting my invitation. To our viewers, I would just say we've been doing this for about 30 years, and over the course of time, you meet people who have expertise that you want to share with your clients and your friends, and Vickie's a person like that. Vickie's a licensed agent, and Vickie, I came across something on one of the online descriptions of you that I loved. You were referred to as a Medicare Sherpa. Can you tell us what that means?
Well, yeah, I signed up for Medicare not too long ago, believe it or not, and I wanted to navigate it and figure it out. So I said, I need a Sherpa. I need a Medicare Sherpa. So when I had the opportunity to start selling Medicare, I figured other people needed a Sherpa to guide them through the cracks and crevices of
That's
Medicare.
right, because it can be complicated, tricky pathway, huh?
Yes, it can.
That's
Yes, it
good. Now,
can.
can you tell our viewers a little bit about what you do and your history?
I am a Medicare broker. That means I represent multiple carriers. So my job is to help you navigate all things Medicare, whether it is your initial enrollment period or once you've signed up and you've been there a while, you want to review your plans. And I come from a marketing background. I was actually in the entertainment marketing business for 30 years.
Oh,
And at 60, I was downsized, so I had to start a new chapter for myself. And I figured everyone starting Medicare is starting a new chapter. So that's how New Chapter Insurance formed.
I love it. That's how you got your name. So our viewers, in case you didn't just hear that, her practice is called New Chapter Insurance. And I wanted to highlight one thing that you said there, Vickie, that you are an independent agent.
Yes,
And
I am.
for those viewers who know me and Keeley in our practice, we are independent financial advisors, which means we're not captive to just one brand or product, but we can offer you anything pretty much that you could do for yourself if you were a do-it-yourselfer. And Vickie's paradigm is the same, right, Vickie?
Exactly, exactly. I am licensed with 8 different insurance carriers, and I'm in multiple states. So I've had clients here in San Diego County that move, for example, to Colorado, or they've moved to Oregon, and I've been able to follow them, or they take me along with them to navigate their Medicare.
I,
So
I understand. We're the same. We've got clients who started off with us here in California, moved all across the country,
exactly.
and we just have to add those states' licenses, pay the fee to become
Mhm.
licensed in each state. We can continue to serve our clients whatever state they might move to. So that
Same
sounds,
process for the Medicare as well.
it does. So I wanted to just talk for a second about the synergy between financial advisors and Medicare specialists. What would you say about that?
I would say that when I'm talking with clients and they want to know, oh, well, what about long term care, or what about my investment for my Social Security, or how's that going to work? I defer to their financial planner for that. That is not in my wheelhouse.
Mhm.
And I defer to a subject matter expert like you, Clark, to do that. Where I see the synergy is pretty much the same in reverse, because Medicare is very complicated and it's fluid. It's constantly changing. There are going to be more changes coming up in drug plans
Mm.
with, the government now being able to start negotiating drug costs. So those are things I have to keep up with. Every year I'm recertified, and, I have to take 9 tests. And so it's
Whew.
on my job to stay up on top of it. And So I would not try to step into what a financial planner has to be aware of and have their fingers on. And so I try to take a little bit of that load off of financial planners when it comes to Medicare.
Beautiful, beautiful. Well, you know that in our practice, we try to bring in for our clients, like we're doing today, other experts who can benefit our clients. And like you just said, nobody can know everything. We don't do taxes for our clients. We don't prepare living trusts for our clients, and we don't enroll our clients in Medicare. But it sure is nice to have a team of people who we can serve the client together, because we put our heads
Exactly.
together, the client has to benefit.
Exactly. And as I said, everybody's starting a new chapter. And part of that I run across is people are like, okay, I'm retiring now and I need to figure out what to do with my finances. And that's where, you know, I can connect them to you as a financial advisor. Particularly, I like to work with financial advisors that we have that synergy.
Yeah.
That way I feel comfortable referring my clients. I know
Yeah.
what you're about. You're going to be around, and it gives them a confidence too.
Well, same here. Whenever we refer to another specialist, we need to make sure that they're going to do right by our client. So it's great to know somebody like you, Vickie.
Thank you. Thank you
So,
very much.
so if I don't see any questions yet from our viewers, so I'm going to toss some out to you, Vickie. Um, Question number one: do people get
Okay.
Medicare automatically?
No, no, that's a kind of misconception. There's a couple of ways your card will come to you automatically. One is if you are disabled and you've received disability payments. You're under 65, you're disabled, and you receive disability payments for 25 months. On that 25th month, you'll be eligible for Medicare, but you still have to apply. You have to send in an application through Social Security and you have to apply. The only way you do not have to send that application in is if you already are taking your Social Security before you turn 65. Then Social Security will automatically send you your Medicare card with a
Ah,
start date the first day of the month of your birthday. So, for example, my birthday is May 4th. Medicare starts May 1st for somebody. If your birthday is March 27th, your Medicare will start March 1st.
good to know.
So you need to have a little runway. And I usually ask clients to give me anywhere from 4 to 6 months. If you're turning 65, reach out 4 to 6 months before, because there are applications you have to put online or in person, and you're dealing with Social Security. So you're on their clock
Hmm.
and you need to have your application in, and it generally takes 2 to 6 weeks for that to
Hmm.
get processed. So today is March 20th, and you say my birthday is March 27th. I guess I should get my Medicare filled out.
Hopefully, you
You're
started back in January or February or
exactly,
January, right?
exactly.
Gotcha. Good to know. Thank you for clarifying that. Another big question is Medicare free?
No.
Could you
No,
speak
I
to
have a
that?
lot of people thinking it's going to cover everything and it's free. And I have a document. If you'll bear with me, I'll share my screen
Oh yeah, okay.
and take a look at this document. Okay, so I am looking to share my document. And the magic of technology,
Voila!
there
There it
it
is.
is.
Beautiful.
There's always that there's always that fingers crossed moment when we're dealing with technology. All right, so what I have here and is the cost for Medicare. You have Medicare Part A and Medicare Part B. Part A covers your hospitalization. I call that if I'm checked in. If I'm checked
Hmm.
into a hospital, if I'm checked into a skilled nursing, that is the part that covers those costs.
Okay.
Part B, now, Part A, if you've worked 10 years and paid into the Medicare system,
Mm-hmm.
your Part A is a zero monthly premium.
Hmm.
Your Part B, however, has a monthly premium, and Part B is the part that you are, hang on just a second, let me get this going. Here we go. Okay, so Part B is the part that covers your medical. That is doctor visits.
When you're not checked in.
When you're not checked in, that is doctor visits, x-rays, MRIs, physical therapy, durable medical equipment. If you need a CPAP machine, Part B is going to cover that. But it's not free. You have a monthly premium, and there's an annual deductible of $240.
Okay, not bad.
Medicare Part B, no, that's pretty good. Medicare Part B covers everything except 20%. It pays 80% of your doctor bills, your x-rays, your MRIs. It pays 80% of that. You are responsible for the 20%.
Is that
Now,
even after that $250 deductible has been met?
that is after that $240 deductible's met, correct.
Okay.
So the challenge is there is a monthly premium for the government paying that 80%. And let's take a look at how that works, because that is based on your income. So if you have done really well financially, congratulations, Uncle Sam's going to want a little more.
Don't you love
So
it?
you will see, and it is all based on your income. So what Medicare does when you get ready to start Medicare, and we'll just use an example, 2024, my birthday is April the 28th. I'm getting ready to start Medicare. Medicare is going to look back at my income from 2022. And depending on where it is in one of these income brackets, this will be the amount you pay for Part B. And if there is an extra income related monthly adjusted amount, we affectionately call that IRMA. If there is an IRMA amount, that is because you have done well financially. And as I said, Uncle Sam wants you to pay a little bit more. And that will apply to not only your Part B, but your Part D if you fall into these other income brackets.
And Part D
And it
is?
And Part D is the drug coverage.
Okay. So we talked about
Because
Part A.
remember,
Part A is when you're checked in. Part B is when you're not
Part
checked
B is
in.
physical,
Part D is
Part B is
prescription
medical.
drugs.
And D is the prescription drug. That's right.
Okay. Carry on. Sorry to interrupt you.
No, please do. Because like I said, I'm the Sherpa. I'm trying to guide, but you got to tell me where you want to go.
Yeah.
So that is also a real big deal. You got to let me know, how do you like to get your health care? What is your budget? Where are we working? Because that all goes into creating the best plan for you. So once you figure out what your cost per month for Part B is, and again, that's based on how you file your taxes, whether individual, joint, or married and separate, and then what income bracket. I have these documents available if anyone is interested and wants to drill down further. Please just reach out. You can reach me on my website. Clark will give you the
I'll be sharing how to contact Vickie a little bit later. Stick around.
So this information is available, and that's how you figure out your Part B. But there is a monthly premium you're going to pay every month for B. It will vary based on your income, and that is about as painless as I can make that.
Thank you. Beautiful. Now, so we've stated that you don't get it automatically. You have to apply, and we just said that it's not free. So the next question is, does it cover everything?
It does not. And in saying it does not cover everything, let's take a look at what Medicare does not cover. Things like dental care, dentures, acupuncture and chiropractic, eye exams. Now, let's flip that. A lot of people go, well, what about my cataract surgery? That is, you're checked in. That's a Part B because you're doing it as an outpatient.
But the outpatient still counts as being checked in.
Yes,
because even though you're out, you're in.
Exactly. So if you're having like a surgery, because that is to correct a disease of the eye, that falls under Part B. if you're like me and I just need to have my eyes checked and get my lenses updated and to get new frames, that's not covered under Medicare. So
Okay.
that means if you just have Medicare A and B, you're going to need to get additional coverage plan for any of these benefits. If you
Okay.
need dental, if you need acupuncture, chiropractic, hearing aids, glasses, long-term care, cosmetic surgery, I'm a little disappointed about that one, and over-the-counter products. So
Gotcha. They're not covered
any of
by
those
basic
benefits,
Medicare. So that's why people get supplements or go with the Advantage plans, right?
right. And that's a good segue into this little darling, which is the, let me see if I can get this a little bigger so those of us that still do need glasses can see. This is what I call the coverage options, and there's two of them. Let's see if we can get there from here. I don't know if you can read all these, but again, if you need this, Clark's your man. He can get you in touch and we will go there. So here are our choices that we're looking at. You've got your Medicare A and B, and the base rate for that's going to be $174.70. Again, if you fall in a higher income bracket, congratulations,
It'll
but
cost
yours is
more.
going to be higher too.
Okay.
So once you have your red, white, and blue paper Medicare card, it'll come in the mail from Social Security. Once you have that, then you can enroll in one of these other two options. You either want to enroll in a Medicare supplement, and that's also called a Medigap.
Because it
So if
fills
you
that
hear
gap between what Medicare
term,
covers and doesn't cover in some
exactly.
cases.
If you hear either of those terms, supplement or Medigap, it's the same kind of coverage.
Okay.
Just like with Advantage, it's Advantage or Part C, or
Ah,
sometimes the Medicare HMO.
okay.
Any of those terms, you're talking about option two, the Advantage plan.
Okay.
And the reason there are additional coverage options is, again, you're paying that 20% out of pocket for your Part B. In
If you
addition,
don't have one of these,
if you don't have one of these, if you just have Medicare A and B, you're
you're
still
liable
responsible
for the
for that
rest.
20%.
And all the stuff that you listed it doesn't cover, right?
Exactly. And that 20% does not have a cap on it. These two coverage options have ways that they cap what you're going to spend. And
Gotcha.
with the Medicare supplement, that cap is based on a monthly premium you're going to pay in addition to what you're paying for Part B. You're going to be paying a monthly premium for a supplement plan. And that will be billed to you through a private insurance company. The Medicare supplement plan does not include drug coverage. So you will need to get a Part D drug plan, and that'll be a separate monthly premium. So you're going to have 3 cards and 3 monthly premiums.
Wow, that's a lot of stuff to lose. 3 cards.
So that's
Can you
one option.
can
And
you
the
just
other
take a
option,
picture? Can you just take a picture with your phone and then show that when you go to the doctor or the hospital?
yes, I do that. I have it on my phone because I don't want to lose it.
Yeah.
Sometimes, however, they need to make a copy. So as much as we don't want to get lost with our cards, you
It's
might,
good to
the
have the
first
paper.
time you're
Yeah.
there, good to have them.
Gotcha.
Okay, so you'll need 3 cards with option 1, the supplement, and you're going to have monthly premiums over and above your Part B premium. Option 2 is the Advantage plan, the HMO or Part C. That one combines A and B into, and that's why they call it Part C. So everything is billed through that one private insurance company. So you'll have one card and one bill that will cover everything. You will still have your $174.70 that you have to pay, but this insurance company now processes all of that.
Oh,
Where
I
if
see.
you go with option 1, Medicare will still process it, pay their 80%, and then the 20% will get billed to whatever insurance company your supplement is with. And then you take your drug card, your Part D card, to the pharmacy to get that filled. That's under option 1. Under option 2, you have one card. that card will get you into the doctor, the hospital, the pharmacy, whatever you need.
Let
So
me
it's one
poke in a
card.
question that I heard somebody ask once. They said, with the Medicare Advantage plan, uh, because it's with option one, you can go see anybody you want, right? Any doctor,
Correct.
any
Correct.
hospital, anything. Whereas with option two, I think it was expressed as being in the lane. That if you're in option two, you're in a lane and you need to stick with your health group, your doctor, their specialists, their hospitals, et cetera, right?
That is exactly
Can you
right.
speak to that for a second, and then I'll come back to my question,
Sure.
which is I'll just tell you lest I should forget. People say, what if you're in option one and you're out of your area? Are you still able to go get help? What if you're not near your provider, your network, your hospital?
Okay, so let me unpack a little bit of that. First of all, you are very on point, Clark, about the difference between option one and two. I equate it, since we're here in Southern California, to driving on the freeway. Option one, you have all access to all the lanes, which means you can go to any doctor, any hospital, any x-ray, any MRI, as long as they take Medicare A and B. That is your fast pass. You can go to any lane.
Nice.
If you have option two, that is your advantage plan, your part C, you pick a lane. Now, that lane could be in this area, it could be Sharp, it could be UCSD, it could be, or it used to be able to be Scripps until the end of last year. But those lanes are your medical groups,
Right.
and your primary doctor is the driver. That primary doctor will be affiliated with a medical group in one of those lanes, and that's the lane you're in. That is the lane that you get your MRI, your hospital's affiliated with. You need an x-ray, you go to where they go. You need urgent care, you go to their urgent care. You stay in your lane. Now, that's not a bad thing unless you have a slowdown in your lane. You cannot leave that lane, go get an MRI someplace else and come back, because if you do that, you are now paying 100% because you've gone out of your lane. You've
Gotcha.
gone out of your network.
What if you see a doctor and they give you a diagnosis and you want a second opinion? Do you have to go out of
You
the lane and pay for it 100% yourself?
you can, or you can ask for your primary care doctor. If you saw a specialist that they referred you to and you did not like that specialist, you do have the option to, or not that you didn't like it, but you do want a second opinion, you do have an option to ask them to see another specialist. If you aren't happy with that one and you want to go see a specialist that's out of network, then again, it's going to be on your dime.
Okay, good to know. So what if you're
Okay.
out of state? What if you're out of the area?
If you're out of the area, again, option one works as long as you have Medicare A and B, whether it's a hospital, a doctor, a clinic, as long as they take Medicare A and B. Now, you might run into some concierge doctors or some acupuncturists or chiropractic doctors that do not take Medicare, don't take A and B. They're going to be out of pocket 100%.
Gotcha. What if you have
That's
option two and you're out of the area?
if you have option two and you're out of the area.
So you're not
Some
near
of
your
them,
network.
if you have an emergency, you're going to be covered. They'll take you to the nearest hospital and you will be covered. But let's say, for example, you break your leg, they'll get you to the hospital, they'll get your leg set. But if you need physical therapy, you need follow-up visits, you need to be back in your network to do that.
Okay. Gotcha.
Okay?
Thank you for clarifying that.
Sure.
So much to know. Let me take a moment and just say, any viewers, first of all, thank you for joining us. And if you have any questions, just type them in the comments. Vickie and I would be happy to address any questions you have. But without those coming in, I'm going to go ahead and say, by the way, somebody gave us a heart. So thank you, whoever gave us a heart for what we're doing here. Another question I had for you while we're waiting for any viewer questions is, what are the most common questions or concerns you hear from clients regarding Medicare?
A couple of things that really come top to mind, because I look at my Medicare clients.
Let me mute that. Okay, go ahead.
I look at my Medicare clients as family. So they're going to be with me, sort of like being in the mafia. Once you're in it for life. So um, I kind of take them through the whole step, and things change. Maybe you are in an Advantage plan your first 2 or 3 years, you're feeling pretty healthy. I'm going to go save some money. I'm going to get on an Advantage plan. But then I got a diagnosis, and I really think maybe I should move to the supplement plan. Well, there's a catch. You only have guaranteed acceptance when you first enroll into Medicare with a supplement plan. So if you have a pre-existing condition, which now you do based on the diagnosis, you would have to go through underwriting, which means that you would maybe not pass and not be accepted and still be with your Advantage plan. And that's why at the front, I talk to people and say, here's the reality. And the reality is, some people cannot afford or have a healthcare budget that allows for those extra monthly premiums. So they look to a HMO. And my job then is to find the best one based on their healthcare needs, based on the doctors they want to see, based on the hospital they want to be affiliated with. So those are all things I take into considerations and questions I ask my clients, because this is a team effort. I'm
Right.
the Sherpa, I'm doing the guiding,
You're the
but we need
Sherpa,
to know where we're
and
going.
like we said earlier, not only, as a financial advisor, I don't know your world, but I bump into it a lot more than the average person does. So the average person who's coming for the first time really needs the guidance. I want to share, we have a comment. Hi, Margot. Glad you joined us. Thank you for joining us. Glad you're finding it
Hi,
informative.
Margot.
We're glad you're here, and we also would say if you have any questions, Margot, pop them in here, and we will try to answer them for you. Thanks for joining us. Okay, Vickie. Now I'm noticing in my image here, your image is kind of locked up. Are you seeing the same thing?
I am, and I don't know how to unfreeze. What happened to me?
I don't know, but
Let me see.
you could exit and then come back in, or we could just carry
Okay.
on and see if it fixes itself.
Um, let's see. We're at 12:27 right now, so we are a few more minutes
Yeah.
in here.
Well, let's stick with it. Maybe it'll resolve, and if nothing else, we still got your smiling face there.
Fair
So,
enough.
can you explain the key differences between Medicare? Oh, we've already done this. Medicare supplement plans. Never mind, you've already got that. What are some of the key cost factors people should consider when choosing a Medicare plan beyond just the premiums? You've been very enlightening about that. But I know there are deductibles, there's copays, there's out-of-pocket maximums. Any overview you can give us of that?
Yeah, going back again to that option one supplement, we know that there's um, monthly premiums with that, but you're also going to need to have, sorry, I took that off. Let me put that back.
Okay, I can put it back.
There we go. So with the option one and two, one, you're going to have the monthly premiums, but you don't have those copays. When you go to a doctor visit, or you go to get an X-ray, or when you use the benefits, you don't have the copays when you have option one. Option two, you don't necessarily have the monthly premium, but you have copays whenever you use any of the benefits. So when you do that, option two, you're going to have copays, you're going to be in network, but you don't have to pay the annual Part B deductible. The way they manage that cost, however, is if you have a maximum out of pocket. So in other words, you're paying copays. Maybe you have to go to the hospital, and that copay for each day in the hospital is $295. And say you're in there 10 days, that's $2,900. Well, you may have a maximum out of pocket. In other words, that's the cap on what you'd have to spend. And maybe that maximum out of pocket is $1,500. Even though you're in the hospital 10 days at $295 a day, you stop paying when you hit that 1,500 or that maximum out of pocket. So that's how your cost is managed. Remember, the main reason you want to get either option 1 or 2 is to manage that 20% that Medicare doesn't pay.
Right.
And that's
And
managed
you can
cost.
either have option 1 and have the liberty to go anywhere you want, but pay more, or you can go
Right.
with option 2 and probably pay less, but have less freedom as to where you go.
Correct.
Okay.
With option 2, with the Advantage plan, to kind of offset that limiting lane that you're in or that network that you're working with, to offset that, they'll include some of those benefits that are not covered by original Medicare, A and B. They'll cover some vision, some dental, some
Right.
hearing, some chiropractics, some acupuncture. Some of
Right.
those are built into the plans. So that's why it's important to understand what sort of coverage a person wants and then find the plan from there. Who are the doctors you want to be affiliated with? Who is the hospital? Do you use acupuncture? Do you use chiropractic? Is there an interest if you could get over the counter products that you normally buy at a
Ah.
pharmacy, but you have a monthly or a quarterly budget built in and you can get those as part of your plan?
Right. So if you're watching this, folks, you can get the idea that there are a lot of moving pieces. Again, that's why I don't try to do what Vickie does. And if you're new to this or approaching Medicare yourself, you can see there's a lot of stuff that it really is a benefit to talk to someone like Vickie who can be your Sherpa, guide you through the passes to make sure that you're finding the one that suits your needs. Now, do you do chiropractor? Do you use acupuncture? Do you have the over-the-counter stuff like Vickie just said?
One of the things in kind of summing up, we're going to talk about what you introduced, the 3 key things. Medicare is not automatic, Medicare is not free, and it doesn't cover everything. Okay, so you're going to need help figuring out what kind of coverage do you need, what kind of plan is going to work best for you. And so you know, every market is a little different, but here in San Diego, we have 66 plans available under option 2.
66?
Under option 2
Wow. Under option
for
2,
Advantage
66.
plan. Yes.
So, yeah, it'd be good to have a Sherpa to
But
guide
not
you.
to make, but not to make your head explode. Under option 1, we have 22 different Part D drug plans available. So you're going to need to know, because in addition, in each drug coverage, because Part 2, it's built in, option 2, it's built in, option 1, you have to get the standalone, but you still have to pay the cost to refill your drugs every month. So even though under option 1, you have a drug plan and you're paying a monthly premium, and for those of you that are doing well, you're paying a little more on top of your monthly premium, you still have to pay to refill the drugs. So that's why it's important to not only figure out your doctors, hospitals, what kind of coverage you like, but what are your medications? So I have you take a list of your medications. We run it against either the option 2 66 plans to see which covers it the best cost wise, or option 1, the 22 drug plans to see which covers it best.
You need a Sherpa, folks. That's what Vickie does. Let me ask another question that I know is important, which is how does Medicare interact with long-term care needs?
Medicare does not cover long-term care. So if you are in a situation that you are no longer able to care for yourself, or it's a memory care situation, Alzheimer's or dementia, or someone's had a stroke and they need help, that is considered long-term after 100 days in a skilled nursing facility. So
100
on day
days.
101, all of those costs now are 100% out of your pocket.
So it's
And
important you hear this, folks. If you're thinking that Medicare is going to cover long-term care, it doesn't.
it
And,
does not.
there are financial vehicles you can use, and you can talk to me one-on-one if you're interested to learn about
Absolutely.
things like insurance products, whether they be annuities or life insurance. There are ways you can go that has a death benefit, if you will, a multiplier. You can turn your $100,000 into 150 or whatever. It's not necessarily that number. But then, should you need real long-term care, you're allowed to use your own death benefit during your lifetime to apply towards those long-term care kind of expenses. But a lot of details in that too. This isn't advice. It's always, you got to talk one-on-one to see what your needs are, how it would work out for your circumstances. And there are details like, you have to, before even a real long-term care policy will pay, you have to not be able to do so many activities of daily living, which is deeper than we want to get into here, but just wanted to shine light on it. It does not cover long-term care.
Clark, one thing I did want to let folks know is that if you use someone like myself, Medicare agent, broker, there is no cost. You do not pay me for my consultation. I get
Important.
paid. I get paid when we get you enrolled in an insurance plan, and I will give
By
you
the insurer, not you, and it
by
doesn't
the
add,
insurance
and it
company.
doesn't make it cost any more than if they had gone straight to that insurer
No,
without you, right?
because they are, as part of their business model, they have allowed agents, whether it's internal or an independent agent like myself. And the benefit of using someone that's independent is I can look at all the United Healthcare, all the Blue Shield, all the Anthem, all the Aetna, all the Humana. I can look at all of those plans. But if
Right.
I'm an agent just with one carrier,
You're not
I
going to
can
talk about the others,
no, I can only show you that carrier's plan. So
right?
that's one reason to take advantage of consulting with the Medicare agent. A lot of people feel a little odd, like they'll go, I hate to ask this question, but how do you get paid? And I'm like, you don't pay me anything.
Yeah,
I get
that's
paid when you sign up. Now, there is a caveat to that I want to add. Only if you sign up with any of the insurance companies that I'm affiliated with. Now, somebody like Kaiser doesn't use agents, so I would not be able to be a resource for you on that.
right.
My brother-in-law is a retired Master Chief in the Navy. He has TRICARE for life. Now, I tell him, do not let anybody talk you out of that plan. You know, you have people call saying, oh, do you get this? Do the, we've got a better plan for you. Don't fall for that
So there's all kinds of
because,
unique circumstances like his, or if somebody has VA benefits.
or federal employees or union people, if they have their own plans, I give them basic Medicare A and B and how to guide them that way, but I really refer them to their plan administrators because those are
Right.
the ones that can do that. I can't help them, and if someone that is a Medicare agent says they can, they're not being genuine about that. I just want to give you a little cautionary tale there.
Thank you. And the other thing I want to point out is if they talk to you, let's say somebody calls you up and you're helping them think through all these different options, there's still no obligation from there either. There's no
None,
cost and
none
there's
at
no
all.
obligation, right?
Right. No obligation at all. If and I will be very transparent because I look at my Medicare base of clients as my Medicare family. So if I can't help you, I will say you have a good plan. It makes sense. You this example, there I met a husband today, his wife, he's under her coverage. It's going to cost him less to stay under her coverage even though he's 65 and can start Medicare. He does not have to start Medicare.
That's
He
an
can
important
stay on
point.
her plan until she's ready to retire, and then they both can start. He does
Very
not have to
interesting.
start
Yeah.
just because he turned 65 if he has coverage that Medicare considers credible, and that's the hook. The credible coverage has to be an employer plan that has at least 20 employees. So
Wow.
if if you're turning 65 but your spouse is under 65 and going to continue to work, you can stay on their health care plan until they're ready to retire, and you will not get a late enrollment penalty. People call me and go,
Fantastic.
"Oh my God, I'm turning 65. They told me I had to turn on my Medicare."
Not
Now,
if they
I'm
have what you just said. Yeah.
exactly. So
Fantastic. You are a wealth of information, Vickie.
I try to look for the long term
Yeah.
because even though you're not going to be my client today, next year, 3 years from now, I've had people that get my newsletter every month. I email it or mail it to them. And they will say, okay, it's been 3 years. He's retiring now. We both want to sign up.
Beautiful. Well, we in our practice, Atterbury Investment Management, like you, have the long-term approach. And
Yeah.
when it comes to Medicare planning, it's such a significant factor of the retirement plan. We're managing our clients' money. We're helping them to diversify portfolio and tend their portfolio over time. But once you hit retirement, a big part of that is your retirement income needs, and Medicare and all this other stuff plays into that. So it's good to work with put more than one head together for your benefit if you're watching this, folks.
Absolutely. Because one of the important things to remember is that Medicare does a 2-year look back. So if, for example, Clark's one of your clients sold their home and downsized and had a big windfall, if that happened in that 2-year window, when they look back, when they're getting ready to start Medicare, they're going to be in that higher income bracket, even though it was a
Right.
one-time situation. So
Hmm.
they need to strategize when those windfalls. My brother had a stock in a biotech company he was consulting with, and they did an IPO, and he got a windfall from that, and it bumped him into a higher category for the year.
Hmm. Hmm.
And then the next year, it goes back down,
Gotcha.
but it will vary depending on your income.
Good. That's great. Thank you for sharing that. Now, before I forget, and I don't think we have time to dive into this, perhaps on another live stream, we can talk about it. But you mentioned the look back period. I know some people want to know, hey, I'd like to have Medicaid or Medi-Cal in the case of California. Hey, what if I give away all my stuff and now I don't have anything? Can I then qualify for that? And again, while we don't want to go into that deeply, there are laws against that. There are look back periods to see how long ago did you give these things away. It's not a good idea to go there, but don't be under the impression that you can give away everything and collect Medicaid or Medi-Cal in
No,
that case.
no, that is not a good healthcare strategy.
So I know we're going long here, but I wanted to just ask you one other question here, I think, and then we'll go on to sharing how people can get a hold of us. Um, can you give us just a brief overview of the current Medicare strategy? Let me come back to this one. And sorry we don't have sorry we don't have you in here. Uh, we
No
lost
worries.
we lost Vickie's live stream. Hey, well, okay.
All right.
Let me see something here. All right. Well, let me just go through the last couple of questions here and say, well, I'll just go to me since I'm the only one showing here anyway. Can you give us a
I'm
brief
there in spirit.
overview of the current Medicare landscape? What's changing? What's coming? Any trends that people ought to know about?
Yeah, as a matter of fact, this past annual enrollment period, the October 15th to December 7th window, uh, the Scripps group pulled out and canceled and terminated all of their Medicare Advantage contracts. So if you were on a Medicare Advantage plan and your doctor was in Scripps Coastal or Scripps Clinic, the you had to switch plans. You had to figure out a new strategy, a different game plan, or change doctors. And I heard that that is happening in pockets around the country with
Hmm.
Medicare Advantage plans because the physicians are not being reimbursed the amount they need to make it worthwhile. So
Hmm.
they are opting in some cases not to renew their contract.
Gotcha.
So kind of important to know.
So when that happens, people basically have to start all over again, navigating all those different plans that are available and talking with someone like you, hopefully to guide them through what's their best next choice, right?
Exactly.
Gotcha.
On the upside, though, as I mentioned earlier, when it comes to prescription drugs, the government, under the Medicare umbrella, is going to be able to negotiate with drug companies to get drug costs down. And it's going to be in increments. The first batch is going to be 10 prescriptions, and they're supposed to be the commonly used ones. I have a list of those. I'm happy to share, with those people interested. But so price negotiation is something that has never happened in the past. Medicare has not been able to negotiate based on the over 60 million people that have Medicare. 32 million of them have the Advantage plan. So about 52% have the Advantage plan. But in the past, regardless of which coverage option, Medicare was never able to negotiate with the drug companies the cost for the drugs. We just had to take what they would give us. But now that's changing starting in 2025. So there are some good trends happening, but from a financial planning standpoint, know that your Part B is going to increase every year. And that 174.70 last year was 164. The year before that, it was 170. So it's going to be up and down.
Like I tell people, inflation is real. You got to invest to offset it. If you put your money in the bank thinking you're doing great at 1 or 2 or 3 or even 5%, after inflation and taxes, you're not going to keep up with this. So thank you so much, Vickie. I just want to share with everybody a few resources, what they can, where they can go to keep up on Medicare changes. And your website is one of them. Let me just share this with our friends here. New Chapter Insurance is the name here, and I'll just show you this. newchapterinsurance.com is where you would find Vickie's website. Her email shows here too, Vickie@newchapterinsurance.com. So you can reach out to Vickie or check her out on her website. I also want to point out that Vickie has a YouTube channel, and it's at youtube.com/@VickieBraden9917. You can see it right here, or just search for Vickie Braden on YouTube and you'll find her. Lots of great videos on here that will help you perhaps dive more deeply than we had time to today. I also want to share with folks.
Clark, if I could just say real quickly on those YouTube videos, I did a series of Medicare minutes, and it was, you'll see the questions. And so if there's a specific topic you want to drill down on, you can go through, and it's just under 2 minutes at the most. So it won't be, you don't have a lot of time to commit.
They're pretty short. So that's a great resource. I also want to share with people who don't know us that we have our own website. It's Atterbury Investment Management is our practice. The website is www.clarkatterbury.com. And we also have a YouTube page. We're up to almost 100 videos right now, and we have all kinds of investment-related topics that you might find of interest. So if that's of interest to you, check it out. And if you want to be notified when we come out with new ones, subscribe to Vickie's and our websites. And I'll just come back. And again, I'm very sorry we lost Vickie's video feed. Vickie, any parting comments you want to share with people before we say goodbye?
I would just say everybody's starting a new chapter when you're turning 65 or retiring and starting your Medicare. If you need a Sherpa, a little guidance on there, please, if not me, find yourself an independent Medicare broker that you want to go through the journey with.
Thank you so much, Vickie. We're really grateful that you came to share your expertise with our viewers and our clients and our friends. And folks, if anybody needs guidance on the investment management side of things, reach out to us. We're here for you. And having said that, we'll say goodbye. Say goodbye, Vickie.
Bye, guys. Thank you. Thank you for your time.